Good afternoon. So I'll be speaking about the communication strategy, and I have my colleagues also who are working on the communication, Daya and Joshila, and the colleagues in the WHO and the government. So my presentation will talk about the communication strategy for the MR campaign, which is started in the month of February and is scaling up to the other 8 states in the month of August and September. So it talks about the 4 components of the communication strategy: advocacy, social mobilization, managing media, both the new and the traditional media, and also planning and monitoring of the communication activities at the state, district, and the sub-district level. So advocacy, you all know, is a process of building the support and the gaining consensus from all the stakeholders, both the policy level, bringing the focus and also bringing the new initiative. And there has been a lot of advocacy has been done related to measles vaccination campaign, and you can see in the states with the ministers, with the MLAs, with the senior leaders, policymakers. So there have been
7 टाइप्स 7 किस्म के वैक्सीनेशन का कार्यक्रम चलाया है और उस 7 टाइप के वैक्सीनेशन के कार्यक्रम में 4 और नए किस्म के वैक्सीनेशंस जोड़े हैं। एक आईपीवी, दूसरा न्यूमोकॉकल निमोनिया, तीसरा मेजल्स रुबेला और चौथा जेई एडल्ट्स, जापानीज इंसेफेलाइटिस एडल्ट्स। इसमें से हम इसको फेज मैनर में रोल आउट कर रहे हैं और इस वर्ष हम लोगों ने मीजल्स रुबेला और न्यूमोकॉकल यानी निमोनिया की दृष्टि से हमने किया है। जो रेगुलर इम्यूनाइजेशन होता था उसमें हम मीजल्स पहले से था, लेकिन अब हमने उसको मीजल्स रुबेला के साथ जोड़ दिया है। हिमाचल प्रदेश भी इस कार्य में अग्रसर है। अगस्त महीने में वो हिमाचल प्रदेश में भी रोल आउट होगा और इस
So there are various have been carried out at different states at the national level. And you can see the pictures from the states how the advocacy is being going on. So various stakeholders have been also been involved, including the government officials, the department from health, education, ICDS, Panchayati Raj, minority boards, professional associations, Rotary and the Lions Club, education departments, madrasa boards, local media, public sector companies, NGO and the religious leaders. With the private practitioners, you can see the workshop going on today, and also we had actually a lot of advocacy, and the message has been gone from the IAP president also, and Dr. Anupam Sajdev actually had also spoke about it. आवाज क्यों नहीं आ रही है?
80% जो उस पॉपुलेशन जो है वो हमारे को स्कूलों में मिल जाएगी इस पॉपुलेशन में से। इसलिए बहुत ज़रूरी है कि हम स्कूलों में इनको दी जाए ये वैक्सीन। और सरकार ने बहुत अच्छे अरेंजमेंट्स किए हैं कि एक साफ जगह पर स्कूल में जहाँ की सब फैसिलिटीज़ हों, आपके वर्कर्स होंगे, हेल्थ वर्कर्स होंगे, सब फैसिलिटीज़ की कोई प्रॉब्लम भी हो जाए तो उसको भी मैनेज किया जा सके, इसलिए किया है। और ये बहुत ज़रूरी है कि हम रियलाइज़ करें कि बहुत एफर्ट लगाई गई है इस कैंपेन को पोजीशन में लाने के लिए।
So इस तरह के messaging has been developed through the various stakeholders, including the private medical associations, the oath taking ceremony at the different state level and the district level has also been conducted. So this is the message, actually the poster which you can also see. This has been designed mainly for the clinics of the private practitioners, the nursing homes, the vaccination rooms where the vaccination takes place in the private or a government hospital, where the associations and the Medical Association, Indian Academy of Pediatrics, Indian Medical Association partners, they are supporting the measles rubella vaccination campaign. There has been a lot of meetings have happened with the religious leaders, influencers, from the different faith groups, from the different faith groups of Madrasa Board, Waqf, Church, Temple Association, Sikh institutions, so that they also support vaccination campaigns. It has also happened during the Eid festival recently, and also in the local festivals of the different religions. Recently, on 25th of July, Government of India also called a meeting of the interministerial departments who are actually critical to support Measles Rubella vaccination campaign. And this is the picture where all the, you can see the line ministries of the Home Ministry, UCD, Health Education, Human Resource Development, Information Broadcasting. They sat together, they discussed how to support MR campaign in the respective states through their own involvement at the different levels. So especially the education department, the ICDS department, who are very critical to support MR campaign. And majority of the children, 60 to 65% of the children to be vaccinated during MR campaigns will be in the schools. So the vaccination session will happen in the schools, both the private and the government schools, the kindergartens, the madrasas, nursery schools, and also schools from the different ministries. So schools under Ministry of Railways, schools under Army and other departments. Apart from national level, also the state level also conducted interministerial meetings. So these are the picture from the state where they have actually called a meeting with the different departments and the different ministries at the state level. And similarly at the district level. So same has also replicated at the state and also at the district level, meeting with the different departments to support vaccination campaign. And also at the sub-district level between the health ANMs, the Anganwadi workers, the Ashas. So when coming to the social mobilization, why there is a need of social mobilization and what needs to be communicated, especially about the MR vaccine, about the why there is a need of the vaccine, and what is the efficacy and the side effect, because this was also one of the issue, especially to build the confidence and the trust among the community members, and also the roles and responsibility of the different members of the community. So these are the major stakeholders who are especially at the community level. The ward members in the urban areas, in the village pradhans, government officials, Vikas Mitra, Tola Sevak, teachers, Asha, Police Patel, Sarpanch, Kotedar, so local influencers, Muslim or the Hindu leaders, postman. So and similarly the different groups who have been tapped in to support MR campaign at the village level or at the urban mohalla and the ward level. And there has been special pockets have been identified, especially where we are expecting that the children could be missed. The slum populations, the mobile populations, construction sites, labor colonies, children who are out of school in institutions, in orphanages, in the JJ homes, Jhuggi-Jhopri clusters, beggar children, and deploying the frontline workers to do the interpersonal communication with this community, with the high-risk communities, and engaging the local level influencers. You can see some of the social mobilization activity which has been taken place at the village level through meeting with the village influencers. You can see also a meeting at the religious leaders groups. You can also see at the like the Dargah, Kaliyar and other places. Rallies which have taken place in the villages, in the urban area, in the schools, and you can see maybe just one sample of it. So you can see the rally happening in a very slum congested area where they are talking about the MR campaign. Similarly, miking and the supervision through auto rickshaws and through other means. Announcements in the trains, in the milk packets, in the bus tickets, in the newspaper ads, and the platform which have been used, different platforms like theaters, tamasha groups, pujas and melas and fairs, mosque announcement, drum beating. I can show you one of them maybe. So it's a temple where this is happening, and also you can see where they talk about the MR campaign.
तारीख 3 अगस्त से आपके क्षेत्र में खसरा रुबेला टीकाकरण अभियान चलाया जा रहा है। यह टीका सभी स्कूल एवं आंगनबाड़ी केंद्रों में निःशुल्क लगाया जाएगा। अपने 9 माह से 15 साल की उम्र के बच्चों को लेकर नजदीकी खसरा रुबेला टीकाकरण स्थल पर अवश्य आए।
So this type gone through the different forums and different platforms, including the religious festivals and the religious events, which takes place through different forums, local folk dance and the matches and the Kathputli shows. School is an important platform, and we all know that about a majority of the children are vaccinated in the schools, and both the private schools and the government schools, including the schools, informal and the formal schools. So including schools which are not registered, Balwari, play schools, boarding schools also. And the government has also issued a letter, which Dr. Haldar had shown in the morning, to different type of schools, the CBSE schools, ICSE schools, and the state board schools, so that they are being sensitized, and they also provide vaccination services within the premises of the schools, and also fully support the vaccination campaign. And you can see how the parents and the teachers meetings have been used, where the teachers have actually oriented parents about the MR campaign, so they are fully supporting of it. So schools also conducted various activities like drawing competitions, and you can see the children who have made different paintings based on the school activities which have happened to mobilize schools in the MR campaign, in support of MR campaign. And this is some of the pictures which children have actually drawn and painted in the schools to create an awareness and also the acceptance of the MR vaccination campaign. Even the radio FM, and also they have also conducted events in the schools, especially the big private schools, where they were initially doing some refusal and the resistance to do vaccination within their school premises. And not only the RJs, but also the various actually pediatricians, and also they have gone personally to the schools and met with the principals and the school administration, and also convinced them to provide vaccination within the school premises. So there have been a lot of messages, and the materials have been developed for catering to different audiences within the community, starting from the TV and the radio spot, where there are messaging around MR vaccination, to a tweet and SMS, and also the short WhatsApp messaging and factoids. Also the traditional poster and banners, and also the training materials for the teachers, for the school nodal officers, for the health workers, for the private practitioners. Not only the printed material, but also the audio, video, and the messaging and the materials in Hindi, English, and the local languages. Posters for the private practitioners, especially for the OPD waiting areas in the clinics. So these are some of the like material. I can show you maybe some of them. So these are the social media messaging which have been developed, so that the doctors can send it to the patients, school can send it to their PTM, through the parent-teachers meeting, to the families. Messaging has been done to basically cover the different concerns and the apprehension of the parents, to covering different aspect of the messaging. This is about the safety of the vaccination program. This messaging used through Facebook, WhatsApp, between the different groups. So between the doctors and the patients group, among the doctors, between the parents and the teachers group, among the health workers, so that this messaging reaches to the end beneficiary. And they are different on the different themes. And this have been all approved, released by the government of India. So they are all approved messaging. Like I can see a global scenario. So you can also use this messaging actually to your groups and also disseminate the messaging so that there is a wider acceptance of the MR vaccination. And these are some of the materials which have been used, developed and used by the states. States have did adaptation of this material into their local languages. So they are in English and Hindi from here, but states have done local translation, and also even sometimes they have also adopted the pictures of the local, so that it's become more localized IC materials. For banner, information card, key messaging about the MR campaign, which has to be shared with the community, with the parents, so that when the parents, they should know also before the vaccination campaign happens, what is measles, what is rubella, and what are the benefits of the vaccination campaign, and why the child should be vaccinated. And this is to be provided to the families prior to the vaccination campaign, either through the teachers in the schools or in the community by the health workers for the children who are younger than school age group or the out of the school children. Similarly, this is the vaccination card, which is called certificate. This will be given to the children after the child gets vaccination. So once the child gets the vaccination on the day of vaccination, the child will be receiving a certificate in the form of this form, where there will be a message recorded that the child had got vaccination on this particular day. Then there are messaging and the leaflets for the teacher, for the frontline workers, Anganwadi workers, for the families, for the community members, and for miking even, the micer, what he has to speak while he's doing the miking in the village and the urban areas. Teacher's handbook, so the teachers also know what MR campaign is, and what the role of the teachers when they are doing vaccination in their schools. And similarly for the religious leaders, for all the religious leaders, about the what are the key take-home messaging about the MR campaign. And then there are monitoring and supervision to ensure the quality of the vaccination, both program and the communication aspect of the campaign. I think that's all from my side. Thanks a lot.